question that was sent to us by a lady who's saying that she had a hair transplant done in Turkey 3 years ago. It was an FUE procedure, and she's complaining that the hairs were placed were in areas where she did not need them, particularly the right temple area here. I'm going to answer this in two parts because there's a lot to talk about here, and so I'm going to address the first issue now here, which is placing hairs where she didn't need, and now she has more hair loss in the area that was transplanted. She mentions the temple. I'm going to zoom in the picture here. So the right temple here, apparently there was more hair there, and then after the surgery there was some trauma and she lost some hair in the area. That's a very important thing. In my practice here, over the many years that I've been doing this, we become more and more careful as we work in between existing hairs. First of all, this should never happen when you have the procedure done and you realize the hairs were not placed where you wanted, right? So, like any other procedure, it starts with a consultation, then you go to the procedure where your physician, hopefully your surgeon, right? And we know maybe in Turkey it wasn't like that, but I don't know where she went to. I didn't see her. But anyway, your provider should talk to you in the morning of the procedure, mark the areas really well, so that you know that you're both on the same page where you need the hair. Every time you try to fill areas with grafts that don't need grafts, where the natural hairs are still very close together, maybe a little bit thinner than it used to be, but if there's not enough space in between the hairs and we try to shove hairs in between, well, we're causing trauma, and many times that will cause hair to fall out in that area. So yeah, the transplants may grow, but then what you lost from the trauma may pass over the transplants, actually the results. So you end up looking worse than you did before you had the transplant. So that's probably what happened here. There was a lot of trauma to these areas where she didn't really need grafts, or maybe needed less. I don't know. Maybe the grafts were too big. Any number of things could have happened here. But as a provider, as a surgeon, I always have to counsel the patients the best way. Maybe if I had seen her, if what she's saying is true, I probably would not have recommended that we address that area of transplants, maybe try medications or maybe a smaller surgery. I don't know. But you have to be careful. So make sure that whoever you are seeing for your hair loss treatment, if they recommend surgery in areas where you really don't think you need, or the hairs are still okay in that area, just be aware of it. So if there's questions, call me. I can talk to you about it and we can figure out what to do. Okay?